Good afternoon. This is your founder and speaker of the Revival Hope Global Outreach Ministry to the world. This is the little doctor, Ronnie Joseph Hobson. And tonight, we'll have an exciting program broadcast live to you with our speaker for My Mess Became My Message. I want to welcome you tonight. I am in the Los Angeles, California airport, but I'm going to welcome you live, our director and speaker for My Mess Became My Message. Doc Michiel, how are you?
I'm doing well. How are you doing?
Hey, man. I'm in Los Angeles, but I'm doing good. Take care now. I'll see you a little bit.
Okay, sounds good. Hello, everyone, and welcome to My Mess Became My Message. As usual, I want you to tell me where you're listening or tuning from, and just drop a word of gratitude. What are you grateful for today? Today, we have an exciting topic, and it is dealing with dialect. It's a dialect, not a disorder. A speech language pathologist perspective on equity in language assessments. And I have my co-host, Queenie, and my two speakers, Dr. Janet Johnson Walker and Mrs. Leslie Uwa. Welcome.
Thank you.
Okay, hello.
Hello. So I just want to say that language is more than words, right? It's more than words. It's culture, it's identity, and history. Am I correct?
Yes, it is.
Yeah. Yet in speech language pathology, children who speak in dialects like Caribbean English Creoles, African American English, or Southern English are often misdiagnosed with language disorders. This misunderstanding doesn't just affect test results, it impacts lives, academic success, and self-esteem. So as a speech language pathologist, I believe it's time that we confront the biases embedded in our assessments and recognize the rich linguistic diversity that exists in our communities. And I have my two guru in dialect who will be exploring the different aspects of dialect and the misdiagnosis that occurs because people are totally unaware. And before I even let you guys dive in, I will give a story about myself. When I decided to become a speech language pathologist, I was the only Black student out of 35 in my cohort. And I was administering an assessment. And after the assessment, the director, she came over and she told me that I had a speech impediment. I'm from Jamaica and I have a dialect. And she told me that I have a speech impediment, therefore, I could not be a speech language pathologist.
Wow.
It was a lot that occurred after that, but nonetheless, I am a speech language pathologist with my doctorate. So I showed her, or I proved to her, that it doesn't matter what she said. It wasn't enough to hinder me from attaining my goal. And I know some people would have taken it and sit back and be like, wow, you said this about me, therefore I can't move forward. But I just want you guys to just set the record straight and let people know what is a dialect. But before you delve into that, just tell us a little bit about yourself and the reason why this is of interest to you guys.
Okay, you want to go ahead, Lizelle?
Okay, sure. For me, dialect and also culture have also always been an issue for me as a speech pathologist, because I feel like a lot of times we're in environments and in settings where Blacks or Latinos, we're definitely a minority, even more so than other settings, because most of the professionals in the field, even like as a speech pathologist, I think we're about 7% of the professionals in the field. So it's like you look at it and it's like what 93% are of the majority population. So when they look at our children, they're looking at them through the lens that, okay, they need to fit into this box. And it's just that I know that a lot of the children are intelligent, a lot of them don't have disorders, and I feel that when they evaluated and seen, they're seen from a lens is very biased. And as a result, we as speech pathologists of color that have experience with dialects, have experience with different cultures, we're able to see that these children really don't have disorders in that way. They are not delayed. They just need to be taught in a certain way, or they need to be shown what you want us to do, as opposed to evaluating them and saying, okay, you're disordered. It's not a disorder, it's a difference.
It is. Yeah. And I actually went into that with my professor as well, that I have a language difference, not a disorder. Okay.
Right.
So how about you, Miss Dr. Janet?
Okay, so Lizelle kind of sum it up for us. Oh, let me introduce myself first. My name is Dr. Walker. I am a speech language pathologist. I am licensed in the state of New York and Connecticut. I work with the school age population. I have experience working with from birth to age 21. I worked in New York most of my life, so I am exposed. I'm in the environment with a lot of immigrants where most of our students are from different Caribbean backgrounds. So the passion for me comes from just being a Jamaican myself as a speech language pathologist working with my people. And that's what I like working in this field. I'm able to give back. My Caribbean people, they see representation when they see me. So it's easier for them to, be comfortable around like me and Lizelle, because they are familiar with us. They see us, they can identify with us. So having a dialect doesn't mean that it's a disorder. It's a variety and different islands have a different variety in their dialect too. So we're going to dive into that a little bit during the discussion as we go along.
Oh, absolutely. Absolutely. So can you define for us what is African American dialect and how does it differ from a language disorder?
So the African American dialect is a rule governed with consistent variety of English shaped by the culture within the African American community. And a disorder is, we call it the difficulty understanding language. And having a dialect doesn't mean that you're having difficulty understanding what the American culture is.
Okay. So pretty much you're saying a disorder is more of you understanding what's been said versus a dialect that is more cultural. It's something
More
that is
culture,
picked
yeah.
up in your environment.
Yes.
Yeah. So why do you think it's important for educators and speech language pathologists to distinguish between a dialect and a disorder?
Well, definitely, this can lead to the unnecessary and inappropriate referrals for special education. You have students coming in, being from different Caribbean islands, and they're being tested, they're doing the evaluation, and because they're not familiar with the language that's here, the SLPs, they tend to say, okay, it's a disorder, so we're going to have to treat them because this is a language impairment. So we have to make sure that they're tested fairly.
Okay. So what's your take on that, Ms. Uwa? Do you have anything else to add?
I would just add that also, like Dr. Walker was stating, like when we also look at the structure of the children's sentences, it's like when we say may produce a sentence, we may produce it with a copula, etc. And a lot of students that are from Caribbean or speak African American English may omit the copula. So it's like these differences are not necessarily seen through the lens like, okay, we know that this is what is a normal rule governed, just as Dr. Walker said, it's a rule governed system. So it's like they're not seeing the rules in the culture. And I think that is what needs to change, is that they are exposed, other speech pathologists from other nationalities are exposed to the rules of African American English or Caribbean English or African English, because the pidgins are also spoken in African countries. So if you have a mixture of all of these students, especially I'm also from New York, it's like we have everything in one area. And then on top of that, we have Latino students. So it's like they also have rule governed languages. So we all have to look at it. And I think the knowledge base, we just have to understand what the rules are. So when we see these children, we're not looking at them like, okay, this is not, you're not speaking standard American English or white English and seeing it as wrong.
Okay, so can you give us an example?
Okay, so as Lizelle said, the missing of the copular, like the verb is, we would tend to say she happy, but the standard structured way would be she is happy. So we always tend to omit is or verbs in a sentence.
Okay, because we pretty much smash words together, pretty much. Yeah. So just like Jamaicans, we do that a lot.
And also we don't have a subject verb agreement structure. We would say they are happy. We just might say they is happy or they happy.
Them happy.
So we just tend to do that. Yes, them happy.
Yeah. Okay, so how can misdiagnosis affect a child academically or emotionally?
Oh, yes. We see this a lot, that misdiagnosis can lead to low expectations, inappropriate placements in special education, and the stigma that's attached to it too. So, and emotionally, children may feel ashamed of how they speak, which can cause them to withdraw, not be a part of conversations with their peers. So they lack that social skills that they need also, because social skills are very important for development. So when they lack that piece of it, it becomes a problem. Because
low self-esteem.
Yes, as a speech therapist, we deal with pragmatic, receptive, and expressive language. And we tend to shun the pragmatics part of it, which is the social skills. And that's very important for language development.
Yes, absolutely.
I can relate to this because I studied in the States for around 5 years. So when I arrived at the US, and I had, I'm not African or anything, but we have our own dialect. We have our own sentence structure here in the Philippines as well. But then, even though I was learning English since childhood, there's still differences, especially in accent, especially in culture. And there was only a few Filipino students in my class, mostly just Koreans, and they tend to flock together. Good thing my grandmother introduced me to the daughter of our treasurer, which was also my classmate, and she became my best friend. But then I really encountered that I wouldn't say bullying, but it was more like prejudice, because I was speaking differently. Like my accent was different, and then my train of thought was different. And I can totally relate to children who are like, being segregated or being cast out because, you're not speaking commonly like most white people. And so, I can understand how these children would feel and how it would isolate them from their classmates, from their peers.
Absolutely. Anything else to add?
I would just say also being a minority in, like you had mentioned at the beginning, graduate school, I feel like I was always very self-conscious of the way I speak and the way I present myself. And it's just like that also will impact, like everyone was saying, children. And it's like their confidence level. They may not even want to speak in class and answer questions because they feel like they're being judged by what they say or how they're saying it. So it's just taking that piece away so that they feel comfortable to be themselves and to show who they are. Because it's like, in a way, you're not always presenting yourself, your natural self. It's like you're presenting what you feel is accepted
Exactly.
in different environments.
And so pretty much you guys are teaching these children how to be their authentic self, because it's okay. It's okay to be Caribbean. It's okay to be different, but that doesn't mean that you have a handicap.
Mm-hmm.
Mm-hmm.
Okay, so what can SLPs and educators do to avoid misdiagnosis of this dialectical dialect, African American dialect?
Okay, so collaborating with families and other professionals, that would also help. And also a big piece for us SLPs is the assessment, which is very important. So Lizelle is very good at the assessment piece, so she could lead this part in a conversation.
Okay.
In terms of assessment, as Dr. Walker was stating, when you assess students, a lot of the assessments that they have that are commonly used, like the CEL-5, the CASTLE, some other assessments, OWLs, which are commonly used. Overall, these assessments are not necessarily standardized on students from Caribbean or African American populations. The CEL-5 did include some African Americans in their standardization sample, but it's still not necessarily encompassing what you would see typically. So in terms of standardized assessments, we feel like they should be used with caution, and that therapists, when they assess students, should really rely upon language samples, also observation of the children, also by speaking to people who speak or know the rules in that community or in that linguistic community that they can speak to whether or not this child is actually displaying a disorder.
So before I ask about the cultural and linguistic mismatches, can you explain to us the phrase that you guys mentioned before? It's a dialect, not a disorder.
Go ahead, Lizelle.
No, just in terms of dialect is like the rules that are in that community. So even different Caribbean communities, there's different rules in each dialectal community. Jamaicans speak different than Trinidadians versus people from Barbados. So we really need to look at each community separately. And when you see the students, take a language sample, transcribe what they are saying, see if they have a content meaning to what they're saying, see if what they're saying makes sense in the context, make sure that they comprehend questions. So these are all things when you see that they are able to comprehend, they're able to express and convey an idea in a way that's meaningful. You have to look at that over looking at maybe an accent to say, oh, maybe they're not saying it the way I would say it. They're not saying tree, they're saying tree, So it's like looking deeper, looking at the semantics behind what this child is saying, looking at the pragmatic, the way they're using language. These other areas also need to be looked at, not just a diagnosis or giving them a specific score, giving them a quantitative item or saying you did this right or you did that wrong, giving more of a qualitative analysis, giving more of a descriptive analysis of what the children are really doing and how they're using language.
Yes.
Yeah, that makes sense. That's why it's important to have the parents involved.
Like I always tell my Caribbean parents that our dialect is a valid linguistic system that is rooted in history, culture, and identity. I always bring that piece. That's how we identify ourselves.
Yes.
Yes.
That's what makes us stand out. That's what makes us different. Okay, so give some examples of cultural or linguistic mismatches in these assessments, because you did mention earlier that it wasn't standardized for Caribbean students. So can you give some examples of that mismatch?
Okay, so I would say like a Jamaica child might say, me I go, which means I am going. So that's what they are used to. That's what they were not taught, but that's how they were raised.
Mhm.
And it's communication, like I always say, that's communication. So however it's said, as long as they're communicating, because communication can be even sign language.
Mhm.
So as long as we're communicating, that's language.
Even as Dr. Walker saying, that phrase that was said, "me are going." So if they look at that and say they were administering the cell five, the formulated sentences, they're showing a picture and the child produces a sentence, it would probably be marked incorrect, or they would be given just 1 point, possibly. And that's if you're dealing with someone that's familiar with dialect,
Yes.
that would understand that there's a dialectal variation. So let's say that the child, they're showing the picture, and even some of the pictures, we said a lot of the pictures have content bias, because if you have a child that's coming from the Caribbean, they may not be exposed to some of the images that are shown on some of these assessments because they're not necessarily used to the American culture. So things
Yes.
that may be familiar to them are not necessarily familiar to an American, and vice versa.
Yes.
So all of these kind of play into the bias because the child is not going to be able to label certain things because they're not familiar with it. But it doesn't mean that they don't know what it is. They don't have that knowledge base. And that's why dynamic assessment is so important, because it's not just looking at what the child knows today, but looking at their ability to learn. So even if you don't have exposure to an item and you're not able to label it, you're not able to produce a sentence a certain way because you don't have exposure. Now, if I give you a intermediate learning point, or I teach you, and that's part of dynamic assessment. After I assess you, I teach you that skill that I saw that you were lacking in, and you're able to show growth, or that you're able to acquire that skill. Then it differentiates. It says, okay, this child is not disorder. They just didn't have exposure to this
Exactly.
item or
Mhm.
this principle.
Mm-hmm. Yeah, that makes sense. That makes sense, because if you're able to learn something, that doesn't mean there's a deficit in it.
Yeah.
It's just the exposure. Okay, so are there any alternatives for testing for Caribbean students to get a more accurate rating?
The DELF,
Yes.
that's a dynamic assessment that is being created for
Mhm.
our children, that's been used. So that's a good assessment that's used.
Okay, so they have one on the market, so that's what is primarily used for children with a dialect.
Yes.
Correct.
Okay. I haven't seen kids in 25 years. I did it on my externship, so I have no idea
What to do for kids.
what the testings are out there. I remember the self because we use it a lot.
Yeah.
Yeah.
It's unfortunate though that DELF is out there, and it's for dialectal variation, but it's not commonly used. Like in my school, they don't purchase the DELF. Everybody primarily purchases the Cell 5.
Yourself, yes.
Mm-hmm.
So it's just like if that assessment is there and people are not using it, it's kind of like just to bring awareness, like this is out there.
Yeah, absolutely. So how do you think you can bring more awareness to that test? I'm sure you're probably doing this research to help to bring more awareness to dialect. But how do you see this changing in the future? Because this is very important, because we want kids with a dialect to feel comfortable. We
Right.
don't want them to have low self-esteem. We want them to be able to socialize in their environment. So how do you see this changing in the near future?
It's gonna take SLPs like us. Like last week, Lizelle and I, we did a presentation in California, bringing awareness to dialect, the dialect versus disorder. So it's the more that we get into it, talk about it. What we want to do next is like open this to like the general public, to like educators, parents, so they can become aware of what's going on.
Mm-hmm. Mm-hmm.
So just bringing awareness to it. So just start with us.
Yeah, absolutely.
Mhm.
Absolutely. So I guess talking more about it because
Even this
I've been to many
platform too.
conferences. Huh?
Even using this platform would bring awareness to what is yet to
Oh,
come.
absolutely. And this will reach millions of people, believe it or not.
Mhm.
But I've been to many conferences, and I don't think there has been much that's been said about
Yeah.
dialectical speakers. There hasn't been much. So that's a good start.
Yes.
It's a good start. So maybe this will prompt the listeners or the professors or whoever was in that room to start doing more research because this is very important.
Mhm.
But we have lots of immigrants with dialects
Yes.
that are being misdiagnosed.
And also, Mrs. Yua, she's currently a PhD candidate. So hopefully in a few months, we're going to have Dr. Uwa with us. And she's
Yes,
going to be publishing a few papers in the future. So we're going to be seeing and hearing a lot about her in
absolutely.
the months to come.
Mhm.
Yes, yes. Congratulations,
Thank you.
Doctor
Dr.
to
Uwa,
be.
Thank you. Dr. To be.
in a few
Thank you.
months.
Yes. And
Yes.
I look forward to reading more about your research.
Thank you. I'm
Yeah.
looking forward to doing more research, even with Dr. Walker. Even at the conference, we were actually talking about compiling like lists of what is typical in different Caribbean cultures.
Mm-hmm.
So, what is typical in Jamaican? What is typical in Trinidadian? What is
Yeah.
typical in Guyanese? So, it's like all of these, if we could like compile a list and show like what is commonplace and have like a place where people can go to really look and see, okay, that they could compare it to. So if a speech therapist has a Jamaican student, they're able to pull up something and look and say, okay, this is a typical pattern. So it won't be so likely for these misdiagnoses to happen. If they
Mhm.
take time and like do a narrative analysis on the child and have them look at pictures and tell a story and see how they're able to use language and really analyze it to see, okay, if this child is not producing past tense markers, okay, let me teach them and see if they know this and if they can learn this skill. I'm not going to recommend that they get speech therapy. So these are also areas that we're looking into in the future.
Oh yeah, and someone asked a question: are there areas in the U.S. that really use these tools effectively that you guys know of?
Not that I know of.
No.
No.
It's unfortunate, no. And that's why it became so salient that it's like really a hole in the research and really a hole in our field and something that we really need to address because it's something where a lot of kids are falling through the cracks because professionals that are seeing them are not really experienced in dealing with their dialect, dealing with their linguistic culture. So unfortunately, New York, I think, is exposed, but I feel like we could do more.
Yeah, absolutely. We can always do more. Do more. What I was thinking as well. Do you guys plan on collaborating with other SLPs in these different countries? And I think that would be a good idea. And at some point, develop a test. You guys could develop your own test.
Yes, definitely, because we met quite a few SLPs who were very open to our topic. They reached out to us. They offered to be a part of our committee that we have, that we're gonna be working together. So it's a start. We have made a start.
Well, that's good stuff. I can't wait. And if I can be on the team, let me know. I'm just
Oh,
kidding. I work
sure,
with kids.
definitely, definitely.
But hey, I'm open to learning. Okay, so now how can educators, so in the classroom, so educators and speech language pathologists better support children from Caribbean backgrounds who speak in dialects or creoles?
Okay, for us, like I'm a Jamaican, so I understand exactly what they're saying. So for other SLPs to know the culture, get to learn the culture, and know how it is that whatever words that they use, try to learn what they are saying. The vocabulary might be different. Like I always say, there's a couple words that it's different. Like we have the word, like I'm gonna take that route to go to New York City. In Jamaica, they might say, I'm taking that route.
Yeah, the root.
Which root is a plant, you know? So
Yeah.
it's different. So getting to learn the vocabulary is, you know, that would be a start. Also understanding how certain words are being said. Like in Jamaica, it says, we say, in America, we say schedule. In Jamaica, they say schedule.
Mm-hmm.
So we might pronounce certain words differently, but it's the same word. So if SLPs get to know the culture, that would be a start for them too, to help with the students.
Absolutely. And then it is also British English.
Yes.
Yeah.
So it's not like we have broken. Yes, patois is broken English, but a lot of the things that we say, you know, we speak in syllables. So I think English is a hard language because we don't speak in syllables. In the Caribbean, instead of saying vegetable, we say vegetable.
Vegetable, yes.
But that doesn't make it wrong. So that, like you're saying, when I first moved to the US, I had a teacher. I was in the 11th grade. She was my English teacher. And whenever I wrote my essays or book report, whatever she gave us, we spelled things a little bit different. So like center, you know, would be CNTRE. So but she picked up on that. So she would circle the words, but then she came to me at the end of class and she said, you are not from here. And I said, no. And she said, oh, you use a lot of British English. And I said, yeah, I'm from Jamaica. But she was aware, like right then and there, she was aware that, hey, it's not that I can't spell. It's just that I'm from another culture and we do things differently. So that's why like you said, it's important for them to know the vocabulary. They take the time to learn Spanish vocabulary, because you test students in English and Spanish before you diagnose that they have a disorder. So why can't they do that for us as well?
Yeah.
So that's important. All right. So now, what role does classroom instruction play in affirming or harming a child's linguistic identity?
You know what? As you were talking, I thought about a concept called cultural humility. And that is what a lot of educators need, cultural humility. It's not looking at one culture as being better or dominant or the standard. And it's looking at the child as an individual, looking at their culture with openness and a willingness to learn. And I think that is something that your teacher did. Like, okay, I understand that you are coming from a background where you have British English or you learned British English. And it's just like, if teachers approach it that way, even some of the errors, they would ask them, is this something that's typical in your culture? Is this something? Just that openness, that dialogue. And it would be less common for them to look at it like, oh, they don't know what they're talking about, if you have a conversation with me.
Exactly. And someone asked, the question disappeared. What is the tool to be developed between husband and wife from different countries that deals with speech differences? It first to help partners understand the nuances.
That's a good question. Again, cultural humility, being able to sit down and have those conversations.
Yes.
It's funny. My husband's from Nigeria, so sometimes he'll say things because they come from a British system as well. He'll say things and I'm like, what was that? What did you say? So it's like he'll explain it to me like, oh, because we say it this way here. So it's like just being able to open up and learn about other cultures and what is common. And I
like that, cultural humility. So looking at a culture with willingness to both learn and understand.
Yes.
I like that. I don't think I've ever heard that term before. So I just learned something new.
Yeah, me too.
Cultural humility.
And there is a variety in different cultures itself. I mean, dialects itself, because people in Jamaica, living in different parts of Jamaica, have different ways of saying different things too.
That's true.
So it's also within the dialect itself.
Okay, so you both work in the schools, correct?
Yes.
You're both in the schools.
Yes.
So, what practical strategies can SLPs in general, or that you guys are using during therapy sessions to support children who speak Caribbean dialects?
For me, I use a lot of visuals, and I might do storytelling from Caribbean cultures. That would also help children to express themselves in their dialects. This also builds the rapport and also support them. So you feel as if you're learning from them. So they feel good about themselves, that they're actually teaching us something that we don't know.
Yeah.
So we are learning from each other.
Okay. So pretty much you try to make them feel comfortable.
Yes.
So it's, yeah.
I also noticed that a lot of mostly SLPs are targeted to children who are in public schools. Because I went to a private school when I was there in the US, and I was wondering what teachers or administrators could do to be able to help children from with different dialects, because I've had classmates that were Caribbean as well when I was studying in Georgia, and there was a lot of miscommunication that was going on. At least I remember my English teacher being able to adapt to them, but then that was just like one person only, but then the other teachers were having a difficult time communicating. So do you have any advice to like private school teachers or administrators that could help these children?
The beginning of the school year, we had something called a culture night, where we have families from different countries coming together one night, sharing their experiences. They brought in food, they brought in just about everything from their country. So that's a way that we could start, by just being exposed to different countries, having a night where teachers and students can come together and learn. Because you have educators come from different countries too. As parents, could teach us as educators too, because that's how we learn, getting the first-hand experiences from them. So having a cultural night, or maybe once every 2 months, or once, but as often as they can, that would help.
Wow.
Yeah, that's definitely a big step.
Mm-hmm.
Because how else to learn someone's culture?
Yes.
But to become a part of it. Anything
have
to
to-
add,
Well,
Giselle?
I would just
Or
add
Giselle?
also, I would also add the cultural night is excellent. Also, sometimes in bringing in literature or books from different cultures. So this year I read some books to my students because everyone comes from different places. I read a Jamaican book called Little Miss Lou, and it had like a lot of language and a lot of words from Jamaica, and I was able to talk to the kids about that. Also, I read another book, Monsoon Boy and Desert Girl. So the kids that are from like Pakistan, they're able to relate to it. And also Eyes That Kiss in Corners for children that are Chinese. So it's just to give them that exposure to different cultures and the ways of saying things, different words, different vocabulary, to make it more commonplace for them.
So here's a question for you guys. What is some strategies for parents with their kids to deal with PTSD from teachers who do not promote cultural humility?
Wow. Wow.
that's pretty.
I think it starts with administration, maybe at the school. We just have to talk with the administrators at the school. let them know what it is, because if you have a school with immigrants, you just have to cater to their needs.
Mm-hmm.
And that's what it is. You can't have a school where kids from speaking different countries, and you're going to like avoid not addressing certain situations.
Right.
So if the administrators they have to play a role in this.
And they have to pick up on, stuff like that, because I've seen a lot of teachers who they see, like, that difference between the students and some sort of bullying that's happening, but then they just ignore it. So like acknowledging that would really help, and with their parents, because when I was experiencing that in middle school, I remember, like, I was just being dismissed because they think that I'm overthinking all this, the segregation, the laughing behind my back, like stuff like that was going on, and then I was like being dismissed. So it was more like for me that I had to adjust myself rather than, like being acknowledged for what I was feeling, being acknowledged for what I've been experiencing during that time. So
Mhm.
the administrator, but as well for the parents to like
Yes.
help
Like
them walk.
sorry. I met a professor that shared a story with us that she's from Africa. And when she came here first, she was placed in special education.
Oh, wow.
Yes. She was placed in special education because they thought that her family were not educated. So her family members that attended the school were not that educated as the American students. So they all placed them in the special ed unit. And it was after a year when a teacher reached out to her and like, no, but this child is different. She's smart. She said at the time she spoke 5 languages when she came here.
Oh,
But
wow.
that teacher saw that in her, and they actually tested her, and she was placed in the gifted program the following year. She skipped a grade and placed in the gifted program.
Wow. From special ed.
Yeah. So the administrators have a lot to do with parent connecting and all that too.
Yeah, there's a comment that dismissiveness from educational systems often leads to mislabeling and assigning students to special education. And that's so true.
Yeah.
It's like you missed out on a gem just because you didn't take the time out to complete the testing.
Yeah.
Because who would have known? And for you, Queenie, I'm sorry that happened to you.
Yeah.
Yeah, you came to a new country and to be dismissed and to be bullied and like you don't matter. That's hurtful. I'm sorry.
Oh yes.
Yeah.
It comes with being in a new territory, I guess you could say that.
But that doesn't make it right.
That's true.
So the dynamic assessments, how can they improve the process?
Dynamic assessments can definitely improve the process because it allows the evaluator to see if the child has the capacity to learn that skill that they're saying that they're having a deficiency in. So giving them training, maybe one session or maybe 10 to 15 minutes, and then retesting them, seeing if they're able to demonstrate that skill after they're exposed to it or taught something. Will give the evaluator a better lens. Okay, maybe this child doesn't have a disorder because they can learn this if they're exposed to it. So it can also, instead of children being pushed into special education, maybe pushing them into an ENL program or ENL classes or something to supplement their ability in certain, like a RTI or response to intervention, as opposed to saying, okay, or labeling them in a certain category, but just giving them the input. Also, even giving the parents training, like, okay, maybe have her read this book or try this website and to allow her to learn this skill because we see that she's lacking in this area because she wasn't exposed to it. So it's just giving that lens. And I think I'm glad that Queenie actually, I'm sorry, just to segue back, that she advocated for herself. It's unfortunate that they didn't listen, but at least you said something. And I think that's an important piece too, is that despite what people are doing, if you continue to advocate, it's like people do eventually have to listen because you don't stop. It's like you parents, even us as speech therapists, we all are like continuing to be that voice that is advocating for kids to get what they deserve.
Right.
Yeah, that's important advocacy.
Mhm.
Because if you're relentless and you can prove, then eventually they'll have to submit. They would have to do what you say.
Correct. That's right.
And what would you like to know? I don't know what that question is pertaining to.
I think that's for the chat, supposedly.
Oh, so the question for the chat. Please write your questions in the chat. What would you like to know? What more do you want these lovely ladies to expound on? And they will try to answer to the best of their ability. All right, now who benefits most from dynamic assessments?
Oh, definitely children from different cultural backgrounds. Yes.
What does that do for them?
Test their true ability. Test where they are. Their language, because it's going to be written in their language.
Yeah.
Like the standardized test that we have here, like you would say, on a snowy day, they don't know what a snowy day is, or I'm taking the kids to a pumpkin patch. What's that in Jamaica? So those are not tests, but I'm just saying. So we have to use words that are in their vocabulary.
Exactly. And a lot of these standardized tests are set up for us to fail.
Like it was a norm for Caribbean
vocabulary.
students. It was a norm for us.
Even the state testing, they are set up for us to fail. Even kids that doesn't have disability. And when my son was preparing for this, the third grade testing to go to fourth grade, and I had to go through and highlighted words, the words that we don't commonly use, and try to explain it to him. This is how they say this, and this is worded like this, because he knows the answer, but because one little word threw him off. So that's why, I don't know how we can advocate for more testing to accommodate us, but at some point we have to be included in these testings.
Yes.
Yeah, it's important. Okay, so I have a timer here, so we only have 3 minutes.
Okay.
So what message would you give to educators and SLPs who are unsure how to support students from linguistically diverse backgrounds like the Caribbean?
I'm going to use Queenie's experience to answer this one. I'm going to be like, just be open.
Yes.
Be curious and ask questions. Like, don't assume that different means a disorder. We just have to learn about the child's background and treat language diversity as a strength and not a barrier.
Yes.
Yeah.
I like that. Language diversity is a strength and not a barrier.
Yes.
That's excellent.
Yes. And how can schools celebrate linguistic diversity among Caribbean and African American students? How can we celebrate it?
I can speak in my school, we have a lot of Haitians in our community. So they actually have like a Haitian American Day, and they bring in Haitian food, and they show the dances and also the music. And always, anytime an announcement is made, it's always made in English, it's made in Spanish, and it's also made in Haitian Creole. So I think that they try to be more inclusive, to give all the students a voice and show them that their culture matters and that they're important.
Oh, yeah. Culture matters and you are important.
Right.
So I want to thank you. Yeah, you have something to add?
No, I was just going to say celebration brings confidence and belonging.
Yeah. You feel a part of.
Yeah.
It makes you feel a part of. You matter.
Right.
You care. I am somebody. So I just want to thank you, ladies, so much for sharing your insights on this topic that is neglected.
Okay.
Thank you for having us.
Thank you.
It's a dialect. It's not a disorder. So I want you guys to remember that. Be proud of who you are.
Yeah.
That's right.
You do not even for your kids, stand up for them. Even if you have to go and speak your whatever dialect you have, let them understand that this is how we perform at home.
Yes.
Mhm.
So in closing, I just want to say equity in language assessment begins with the willingness to listen, not just to words, but to context, culture, and identity. When we shift our lens from correctness to communication, from standard to strength, we empower every child to be seen, heard, and supported. It's not just about changing how we assess, it's about changing who gets to belong. Because a dialect is not a disorder, it's a voice that deserves to be understood. So I want you guys to share, comment, and tune in next week for our topic will be breaking free, healing from traumatic relationships, and reclaiming your power. You do not want to miss it.